It is a worldwide phenomenon that we are expecting and that we are experiencing at this point here in Quebec as well.
Quebec is seeing an increase in COVID cases and hospitalizations, driven by new Omicron subvariants. Public Health updating the province's COVID situation on Wednesday. They say variants account for about 75% of infections and appear to be more transmissible than previous strains, but not necessarily more severe, adding the rise in cases was expected, though it came earlier than authorities had thought.
There's many factors involved in the resurgence of cases as we speak. Definitely, the lifting of public health measures, we expected that would have an impact because mask is quite efficient to reduce transmission, and the lifting of the measures allowed the virus to circulate more freely. Add to that the waning immunity from either past infection or from vaccination itself. We know after 6 months, either after infection or vaccine, that there's waning immunity and you can get infected or reinfected. So it's a combination of all those factors altogether that seem to be triggering this recent upsurge in transmission in cases.
But Public Health saying they don't plan to recommend any restrictions or mask mandates for now. They do recommend that people over 60, the chronically ill, and the immunocompromised take precautions, like wearing a mask in public and in crowded spaces, and getting their second boosters.
The impact of the variant is that with the vaccine, you could not necessarily prevent all the risk to be infected, but if you are, you will have much better chance not to get a very bad COVID, and especially a COVID that needs to be hospitalized or even in the intensive care unit, or long COVID.
COVID-19 patients up by 34 in the last 24 hours, 1,260 people in hospital fighting the virus, and 4 more deaths added. Boileau concerned with the impact on the health system and working with hospitals to readjust services when necessary. 6 ERs in the province already closing for the summer due to staffing shortages, and over 6,200 healthcare workers absent for COVID-related reasons.
It's a tough ride. It might be a tough ride, but it's feasible. We do not think that this hiring of case will get very, very high in the near future. We expect it to be to continue to rise again, but to be followed in the next few weeks by a lowering, which would be great.
In Montreal, Brittany Henriques, City News.